Good afternoon and welcome to the third floor conference room of Waco City Hall. I'm Larry Holsey, Director of Municipal Information and Communication for the City of Waco, and I'd like to welcome you to our weekly press conference that we're holding here. We're all social distancing here. There's only 3 people in the room, but we're still wearing our masks to show that we are encouraging the use of masks in what we're doing. We have with us today our Mayor, Kyle Deaver. We have also Judge Scott Felton. We have Dr. Richard Haskett from the Providence Ascension Providence Health Plan, and also Dr. Ben Wilson, who is representing the Family Health Center. And as always, we're always thankful that we have the opportunity to provide this same information to our Spanish-speaking audience. Down in our studio on first floor City Hall, we have a Spanish interpreter recording an audio track that is all in Spanish, and at 4:30 this afternoon, we'll be replaying this entire press conference with a Spanish translation on it so that all of our Spanish speakers will have the full benefit of everything we're talking about today. We're also inserting an American Sign Language so those persons can also enjoy and benefit from what we're doing. And always so gracious to be a part of our press conference is our City Council representative for District 2, Hector Sabito, to invite our Spanish speakers and tell them about the broadcast this afternoon at 4:30. Hector?
Good afternoon, Larry. Para ayudar a nuestros ciudadanos que hablan español a saber lo que se dice durante esta conferencia de prensa, un traductor está grabando en español en vivo. Esta grabación completa en español reemplazará el sonido del inglés en el video y una versión en español de toda la conferencia de prensa se reproducirá en el canal de cable de la ciudad de Waco aproximadamente a las 4:30 de esta tarde. Puede ver la conferencia de prensa en el canal 10 o por internet en vivo en wccc.tv. Larry, thank you again for the opportunity.
Thank you for always being a part of it and helping us with that communication. Let me outline how we will be doing the press conference today. It's very similar that we've done in the past. We're going to allow each of our panelists to make an opening comment, whatever's on their mind and heart, information that they want to share with the community. And then following that, I will read questions that I've collected and the media and other persons have suggested that we'd like to bring to the attention. And then we do have 3 representatives from the media that have registered, and they will be asking a question. We'll do 2 rounds, probably 2 questions each. And then following that, we will allow all our panelists to do closing remarks and everything. So to start everything off, let's go ahead and start with opening remarks. We'll start with Dr. Wilson, followed by Dr. Haskett, then Judge Felton, and then our Mayor, Kyle Deaver. So if you will, Dr. Wilson, we'll let you kick it off.
Yes. Thank you so much, Larry, Mayor, Judge. Pleasure to be here today, truly. And as you may have mentioned, my name is Ben Wilson. I'm the Associate Chief Medical Officer from Waco Family Health Center. I'm going to just start off with some opening statistics from national scene, the state, and then down to the county. So let's go ahead and start going through some of that. Worldwide, we have now 2 million additional cases since last week for a total of actually, it's about 1.5 million additional cases since last week for a total of 20.1 million cases. We've had over 730,000 deaths worldwide. In the United States, there are now 5.1 million cases, up 300,000 from last week. There have been 164,000 deaths in the U.S. Shifting to the state numbers, per the Texas Department of State Health Services, there have now been 500,000 cases in Texas and 8,700 deaths in our state, roughly. To give some perspective, the state daily new cases have been on the downslope. The hospitalizations are doing the same, so that is somewhat encouraging, thanks to the masking and the social distancing and other efforts that have been put in place. The positivity rate, to speak on that in Texas, was on a downward trend as of late July. We've seen more of it was initially a gradual upslope, and now, at least by the DSHS data that I'm looking at, appears to be on a more dramatic upslope, the positivity rate. It's now 23% versus 14% last week. there's actually I believe, a question with regard to this here shortly, so I'll refrain from further comment on this particular statistic until that question pops up. In McLennan County, though, our positivity rate has essentially remained unchanged from last week. It's still 13%, and I would note that's down from 22% countywide in early July. So that also is signs of positive things happening here in the county. More county numbers. We now have a total number of confirmed cases of 5,164. 1,779 of these are active cases. The 7-day rolling average is also, there's also room for good news there. That is now 59, whereas it was 83 a week ago. And so, again, the 7-day rolling average is, we love averages, gives more of an indication of what is actually happening in the macro scheme of things. And so that has come down from 83 to now 59. It was in the 200s, as high as mid 200s in July. As of this afternoon, the Public Health District has received notification of 54 new cases of coronavirus. Currently 55 people are hospitalized with COVID. This is less than last week. Last week it was 63. There's currently 13 patients hospitalized with COVID on ventilators. So 13 people on the ventilators. It was 14 last week. We have 70 total deaths as of actually this morning, including 5 deaths within the last 24 hours. 2 of those were Hispanics and 3 whites. I'll move now to the, I know that Dr. Griggs in the past has commented on what is the effective reproductive number, or the RT. That's a fancy biostatistical way of talking about here in our county, basically, for every one person that gets coronavirus, how many people will get coronavirus from them based on how effectively we're doing social distancing and masking and such. Currently, our number per the UT School of Public Health is 0.97. It had been 0.85 last week, so that's up a little bit. Anything less than 1 means we are overall suppressing the virus, so I still think there's room for good news there. We want to keep that number as low as we can, though, to limit spread of the virus. To speak about nursing homes, currently there are 11 ongoing facility outbreaks. This is somewhat of an improvement from last week around this time. These are concentrated in just a few facilities. Mostly, there have been a total of, let's see, actually I'm going to move to the county jail. There are 24 active cases in the jail, 20 staff and 4 inmates. A good many, from what I understand, a good many of them are in the same pod. So that is makes it easier to contain. And so in some respects, that's encouraging. The public health testing collaboration with the state continues to benefit our city, and actually will finish up on the 15th, so here in 3 days. So then after that, that will be the end of that, at least for the time being. I don't have current numbers from that, so that is the end of our statistics for this portion of the conference.
Okay, very good. Before we move on, I'd like to welcome Dr. Morrison, who is the Chief Medical Officer for Baylor Scott & White. We didn't know for sure whether you're going to be able to make it, Dr. Morrison, but you're here. So in the order that I had on my printed form, I'm going to let you go next before we go to Dr. Haskett. So whatever opening comments you'd like to share from Baylor Scott & White.
Hey, thank you, Larry. And as always, just want to say how grateful I am to work with community and city leaders that are committed to us having a solid response to the COVID pandemic and keeping our community safe and functioning. So thank you for that. As Dr. Wilson noted, case numbers, hospitalization numbers have flattened out a little bit across the county. We do have, toward the end of this surge, I don't think it's surprising. We have sicker patients still remaining in the hospital, more in the ICUs, and more on the ventilators. Our staffs are working hard. We have capacity, but we are stretched without a doubt by the current caseload. We're concerned a little bit about the stabilization and plateauing at still a relatively high rate, double-digit new cases, case positivity rate still in double digits. Leaves us a little concerned about where we're going, but we are currently stable and still pushing forward.
Okay. Dr. Haskett from the Ascension Providence.
Good afternoon. I'd like to echo what my other physician colleagues have said, and very grateful to be allowed to participate in this call. And I guess even more grateful since I grew up here and my family pretty much all lives here, for the incredible collaborative community response that I've been a small part of and that I've been able to witness. I am the Chief Medical Officer of Ascension Medical Group in Waco. So what that means is I have accountability over our clinic system. Dr. Becker, who you're used to see here, is accountable for the medical leadership of our hospital part of our network. And Brian is one of my dearest friends. I'll try to hold his place until he gets back from vacation. I'd like to change the conversation a little bit, though, about something that I think the community needs to know a little bit about, which is what's going on the outpatient network. And I'm going to tell a little bit about what we're doing here at Providence, but the things I describe are being done by our friends at BS&W and our friends at FHC as well. They may have different names or different processes, but we're all doing the same thing in a common effort to combat the disease. For us, I think it's important to know that all the networks were early into the drive-through testing. For us, it was a 10 by 10 tent in spring break. But right now, we're over 6,000 drive-through tests just in our outpatient system alone. And we're very proud of that effort and proud of our community partners, because that keeps a lot of pressure off of the hospitals, which is really what we need, is the ability for people to get their diagnosis as quickly as possible. And I think every day brings us a little bit closer to having a more democratized and easy approach for testing. We're certainly not there where we want it to be. I think we would all acknowledge that. We're infinitely better with the passage of time, and I think we'll continue to do so. We've also repurposed our Express Care location in Lacey Lakeview for what we call a complex triage clinic, which is anybody who has COVID symptoms or proven COVID disease is seen at these clinics, where we can really optimize the safety of the patient and safety of the providers. There are various constructs: drive-through testing, drive-up testing, drive-through evaluation. There again, this is something we're all doing with our different versions of the same core message, that we're trying to keep people safe. And I think that all the networks have done a very good job of not only shutting down the clinic system because we had to, evolving to telemedicine, which has been incredible, and we've all lived to see that, and I hope the community has reaped some of the benefits from that, and now rebuilding in a fashion that we feel is clear and safe and accountable to the needs of our associates, the needs of the community. We'd like to continue to draw the heightened awareness that we all want the same thing, which is our life back. And the best way we can get our life back is through a common approach to the things that are easy and all within our power: masks, social distancing, a little bit of common sense. We'll all get there together because Waco deserves it.
Thank you, sir. Judge Felton.
Good evening. I don't have a lot of opening comments except to welcome Dr. Wilson, Dr. Haskett to the group. I think it's good that we're getting kind of a broad perspective from the medical community around here by having different ones come in and speak to the community. And of course, again, appreciating Dr. Morrison and Jackson Griggs for their participation in it. I've said this before, but I want to restate it because I really believe it. It's been this way a while, and I think it'll be this way for the long time in the future, that we have a real strong medical community that is very engaged with what goes on with the public in and around McLennan County. And we're so fortunate, and also the fact that both Providence, Ascension, and Baylor Scott and White Hillcrest have a pretty deep bench, because they're with their organizations are large and across the state, and so that gives them some flexibility to be able to react to extreme things that may happen. And fortunately, they've been able to manage through this very well. And I just think we're so lucky, and I just wanted to state that. And so I'll look forward to answering any questions later on.
Mayor Deaver.
Thank you, Larry. Thank you to everyone for joining us today, and to those that are participating with me here today on the press conference. I will jump right into a few slides here. This is the slide that we always begin with, which is the cumulative number of confirmed cases in McLennan County. We passed 5,000 cases day before yesterday. I want you to remember that we went from March through May with a total of 118 cases. We topped 1,000 on July 1st, 2,000 on July 8th, 3,000 on July 15th, and then 4,000 on July 27th, and 5,000 on Monday. So the good news is that we are starting to see more time pass between each 1,000 case interval. The bad news is that we have many, many more cases in our county than we really should have at this point. This slide shows new cases since June 1st. You can see that we are gradually trending down. We had a little bump in the first week of August. More public testing that we've been doing is going to yield more confirmed cases. But that's really a very good thing, because it should decrease the number of asymptomatic patients who are wandering around without knowing that they're spreading the disease. So we really appreciate everyone that is getting tested, and that testing may yield a few more numbers, but that's where the positivity rate is also something we need to really concentrate on. This is the hospitalization, as was just discussed. Our hospitalization numbers are coming down slowly, and that's a very good thing. But you will notice the gray line below, which is patients on ventilators, and it is not declining at the same rate as the hospitalizations are. So as Dr. Morrison said, we have fewer patients, but a higher percentage of sicker patients than those that are in most need who are on ventilators. So that is something we have to continue to watch. We've talked about this before, the fact that hospitalizations lag behind new confirmed cases. It's logical, but you just need to think about that. So we've had that spike in cases back in early July. Then we had our spike in hospitalizations in late July, and that's now starting to decrease. The last thing that we have to talk about here is fatalities. And fatalities obviously trail those new cases, and then hospitalizations, and in many cases, ventilators. Last week, we had 16 new fatalities to report. That is the third week in a row of a record high number of fatalities in a week. We hope to see that, we hope to see these start to fall, start to see the fatality numbers come down now that hospitalizations have come down. But we also need to recognize that 16 of our friends and neighbors here in McLennan County lost their lives to COVID-19 this past week. And we've got more fatalities to report this week. We hope we won't set another new record, but just to let you understand and hope you understand how serious this really is. The positivity rate was mentioned a minute ago. Again, Texas is seeing a rapid increase in positivity. We were declining across the state in positivity from mid-July till early August, but the last week has seen a huge increase in those in the positivity rate. And as was mentioned, the 7-day average is now near 20. The actual daily rate was close to 24% on Monday, which is the latest data available. In McLennan County, we were above the state average. We are now below the state average, and at about 13% on a 7-day rolling average rate. And that's a good thing, but we need to continue to get down below 10 and then below 5. I want to go back and show you one other thing that is concerning on the state level. which is look how these blue bars are the number of daily tests that are conducted. And look how much we have dropped off. We were doing about 65,000, 67,000 a day at our peak. Now we are down in the 33,000 range. We need to get those test levels back up so that we can spot these outbreaks quicker and deal with them better. That is all the slides I have. A couple of additional things I'd like to discuss. All of this requires that we remain vigilant and that we continue to act as though we are under a shelter-in-place order to the maximum extent possible, to continue to wear our face masks. We are at a place right now with schools about to start opening where we are pretty vulnerable. And it's just going to be important that we do everything we can to get that community spread down as low as we can as schools start to open. Otherwise, we are likely to see a lot of problems come out of that. I want to reiterate the free testing that is going on tomorrow, Friday and Saturday at MCC. It's the Highlander Gym at 1710 Powell Drive. It is from 8 a.m. to 4 p.m. Just like the past testing, it is free. It is a mouth swab, so it's not the invasive nasal swab that you've heard about or may have experienced. And you do not have to have symptoms to take part of this. So if you have any reason to believe that you may have contracted COVID-19, please take advantage of this testing. It is really, really important to our community. And I so much appreciate the Waco-McLennan County Public Health District, our Emergency Operations Center, and Texas Department of Emergency Management for partnering to make this available to us. Larry, I'll turn it back to you.
Okay, let's start off with the questions that we have. What plans does the health district have in case of an outbreak at school, such as what happened at Etowah High School in Georgia this week?
Well, I'll speak to that, Larry. We certainly hope that that does not happen. We hope that the schools will employ better social distancing measures and mask measures than were used in that school in Georgia, where we saw the photo a few days before this outbreak of many, many children, students in the hallways gathered without masks and not distanced. But if we do have that kind of outbreak, it would likely lead to a temporary closure of the school. If it was an outbreak of that size. That will be a question for Dr. Werner, who will be working with the administrators at the school district to figure out what the best process is. And honestly, it's going to be a case-by-case situation for now. I think that will probably evolve as we see how these things are going to happen over time, but that's where it's going to start right now.
Okay, how will the health district coordinate with schools, and how equipped is it to handle the contact tracing that comes with a larger school outbreak? And for example, do we have the resources for mass testing at schools?
Well, schools are required to report any positive cases to the health district immediately, and an email account has been set up for them to report 24/7 on that. The contact tracing would be what we've talked about all along, which is close contacts of that student or teacher or any other staff there at the school would need to be contacted and let them know that they need to quarantine for 14 days. The EOC is working on setting up teams to conduct mass testing if there is an outbreak in schools. Frankly, I am concerned about that. I think that the EOC will be able to do that, but I'm really concerned about turnaround times from labs as schools across Texas start to reopen. I think we're liable to have some real difficulty there.
Okay. The state's positivity rate is now much higher than McLennan County's. Why is that happening?
Dr. Wilson, can you speak to that, please?
Yes. I think a good explanation, maybe for the most part, lies in what Mayor Deaver just said about how apparently the testing rate for the state has gone down. And so a positivity rate is a fairly simple division. It's you divide number of positive cases by overall number of tests done. And so if the overall number of tests being done goes down, then of course the positivity rate goes up. I don't know for sure. It's hard for me to speak to reasons behind some of the state data. My knowledge base and maybe my contacts just don't extend that far, but I know a little bit better what's going on here at the county. But I think Mayor Deaver had a good explanation, and I also don't know if maybe there was some sort of data dump per se of where you had an organization or a county that had a lot of positives only report their positives and not their overall number of tests done to the state. Just pure speculation, though.
Okay. How much testing should we be doing between now and the start of school?
Yeah, that's a great question. We should be doing, in short, we should be doing as much testing as we can. We really don't want to let up. We want to do as much testing as every organization has access to, and as much as we have access to countywide, whether it's through our healthcare organizations or through state opportunities like the community testing sites that have been set up recently. I don't think that's a good strategy to somehow ration tests for the start of school, and I don't think anyone is doing that. The reason being that every positive case that we can detect right now helps prevent further cases once school starts up. So that would be my answer to that.
Okay, I've seen many residents of Waco-McLennan County spreading conspiracy theories about the virus either on their personal social media and our posts from the Public Health District, like ads from testing sites and daily updates. What are our leaders doing to help combat dangerous conspiracy theories in our community?
Judge Felton, would you take that? And then I may have an idea or two about that as well.
Okay, I hope you do. Conspiracies are a big part of our society these days, and especially when it comes to figuring out what an authority might mean or might really mean. And so that is going to happen. The best way that we can be a part of that to try to get people on the right track is ask them to do a little bit of work and research, and a lot of these can be dispelled, or some of them may have some bit of truth to them as well. Unfortunately, when this pandemic started, it started, of course, on another continent, and there was a lot of conspiracy around that as well, and it's just moved across the water to us. And some of the numbers that were first being calculated weren't exactly right. Some might have been overstated, some understated, but that's just going to happen on something this massive and big. But I'd tell people, be responsible don't believe everything you read on the internet, and try to do some research and find out the answer, or call and ask some people that you think might know. But Mayor, I look forward to hearing what your thought is.
Judge, I agree with all of that. And, I continue to be hopeful that this will become less politicized. I think the fact that President Trump, for instance, has said that you should be wearing a mask should give people some comfort that they need to be doing that if they were doubtful about that before that. I would suggest that you talk to your family doctor. Talk to someone you trust who is in the medical field, who is following the science. That's what we are trying to do here. And also consider that this is a worldwide pandemic. Every country in the world is dealing with this. So it seems odd to me to talk about it in terms of being Republican or Democrat in terms of an election season. We are doing the best we can to try to keep our community safe, and we just ask that you do the same.
Okay. 2 weeks ago, it was said that plasma from previous COVID-19 patients was being used for those currently diagnosed with COVID-19. Can or will the blood of a person who dies of COVID be donated to help treat others? And kind of on that same topic, and if a person dies of COVID and they are an organ donor, are their organs still eligible for donation?
Dr. Wilson, can you address that, please?
Yes, sir. Another very reasonable question, because convalescent plasma is in some cases being used to treat coronavirus infection in the hospital. I can't speak to exactly what's being done here in our hospitals, but nationwide it's been a treatment that's been used. Convalescent plasma basically is just talking about if you have antibodies to coronavirus in your blood, then we could extract those antibodies and give them to someone else to help them fight the infection. Antibodies are part of our blood that help fight the infection. The specific question that's being asked is what about a deceased person? Could we either use their blood for that same purpose as what we call convalescent plasma to fight the infection? And then also, there's sort of a separate question for, let's just say, the same deceased person. Can their organs be donated for other reasons? The answer, I believe, in both cases is no. That you can't, and I don't think that anybody would use blood from a deceased person to certainly to treat current coronavirus infection in a live person with current infection. And I don't know of any thing that blood from a deceased person is used for either, although I'm not an expert in organ donation or donation of any part of the body or blood in this case. And again, the organs eligible for donation question from a COVID positive patient. No, I actually confirmed with the Texas Donors for Life, and no, that is an exclusion, what we call an exclusion criteria, or a reason that our organs cannot be donated is if it's from a deceased person that has COVID.
Okay. What is the status of the McLennan County Judicial System, and how is this impacting the court load since we haven't had trials in many months?
The Office of Court Administration has issued several orders that have moved the date back for when a trial can be held. And right now, the Supreme Court in Texas has declared that there will be no court proceedings before October 1, except for a few test trials that will happen across the state to be sure that you having a virtual trial is something, first of all, that makes sense, that it's functional, it reaches the goals it's supposed to reach by law, and also to, in some cases, test the law regarding virtual trials. There's always consequences to all of these things, and the fact that it's been pushed back has caused some issues with here in the county. Our jail numbers are growing a little bit. The other thing is because we're trying to get some control on the jail numbers, that there's a lot of folks that are out on bond that might be on the borderline of being in jail. There's pretty strict criteria about that, the bonds issued for those people and what their crimes were alleged to be. And the other thing that's been that we didn't expect is the state has quit picking up what we call paper ready inmates. In other words, they've gone to trial, they're guilty, and they've got to serve time in the state penitentiary. And the state's had some outbreaks, and so they quit taking them and left them with us. So we have feeding and care of those inmates until that changes. So that's causing a backup as well out at the jail. But the other thing is the federal contracts out there. The U.S. Marshals are asking to find more places to put inmates, and we've got, I think, 271 or 2 out there today, and we've always had 200 to 300, so pretty much kind of back to normal. But those are the consequences of what's going on in the judicial system. The courthouse is very quiet around here, and it's generally bustling with activity. And so if you come in here, one thing you have to have and one thing you can't have. You have to have a face mask, and you can't have a pocket knife. So be sure to leave it in your vehicle if you have one. Thank you.
All right. Tenant evictions is a hot topic across the state, with protection bans expiring. Several cities in Texas have adopted local moratorium rules on evictions that some say oversteps the authority. Other cities are offering rental assistance funding. What are the rules on eviction in Waco, and what can someone do with their landlord if they try to evict them?
So Larry, we in Waco have not put in any kind of eviction moratorium other than that was imposed by federal legislation, which is about to expire. And I think we could expect as many as 50 to 75 evictions per month, or eviction cases per month going forward if the legislation is not put back in place, which is something that has been debated. And if Congress can get an act passed, I think that it may very well include additional moratoriums. We are offering at the city a rental assistance program. And that is available by going to the covidwaco.com website and looking at resources there. The application needs to be completed, and we can help work with that. And then the tenants need to work with their landlords and try to get them paid what they can. The landlords have been enduring a long period of no rent or low rent during this time, and so this is just a difficult time for everybody. Mm-hmm. But please, if you are interested and in need, look at the covidwaco.com site for our rental assistance program.
Okay. Locally, how are our first responders, and kind of specifically like AMR, the ambulance service, the fire personnel, who are coming in contact with people who have tested positive for COVID-19, how are they holding up? And are there staffing shortages among their ranks?
Well, we've talked about this a fair amount. I mean, these are very stressful jobs under normal circumstances. And you add COVID-19 to this, and being a first responder just became a whole lot more dangerous. We do have good personal protective equipment on all our fire department staff. And I'm told that AMR, the EMS provider, does as well. And we have experienced a few positive cases. We have not identified that any of those cases have come from dealing with the public as a firefighter that I know of. I believe that's correct. We're not sure whether some of those may have been community spread or not, but in any case, we've had that happen. AMR has had that happen as well, and it has affected a few employees at a time, but we've both had enough backup employees that we have not had any kind of shortage that would cause any problem for the public at this point.
Okay. Last week, it was mentioned that it is important for everyone to get a flu shot as soon as possible this year. How does that affect our battle with COVID-19?
Dr. Wilson, I'd like to ask you to answer that, but Judge Felton, could you speak to the prior question? I'm sorry, I meant to call on you that.
Okay.
Do you have any idea where the Sheriff's Department is on that?
Well, exactly like the city, we're not sure exactly where some of these folks that tested positive that work for us, where they exactly got it. More indications are from community spread than any particular incident, but and where our force is in full force. We have had some people that were home for a while, especially in the jail. But those jailers are, most of them are already recovered and back working, and then patrol the same way. We're in full force right now.
Thank you, Judge. Dr. Wilson, if you could speak to the importance of a flu shot this year.
Yeah, you bet. This is one of my soapboxes, and I love to talk about this very topic. And so it's going to be as important and even more important this year that everybody gets a flu shot. And I know we have anti-vaxxers, and it's a political topic year after year, but if we're ever going to become of one accord on the topic of vaccinating, particularly the flu vaccine, this is the year to do it. So it's critical that this happens for a variety of reasons. One of them is we're already going to this is going to be a rough cough and cold season as it is because of this new strain of coronavirus, the COVID-19, SARS-CoV-2. So we've got a new strain, a new cough and cold virus running around that's highly infectious. We've got all the old strains of other cough and cold viruses apart from flu, rhinovirus, what we call RSV, just various viruses that cause cough and cold. And so, in other words, we've got enough on our hands without the flu. Now, these other viruses cannot, as of yet, be prevented with a vaccine, but as luck would have it, we do have a vaccine for the flu. And so why not take advantage of the blessing that's in front of us there we can vaccinate against actually I would say one of the deadliest of all of the common cold viruses this season, second to COVID. So we want to eliminate, really, first of all, we want to eliminate school and work absences as much as possible. And one of the main ways we can do that is by vaccinating against the flu. So that's the first reason I would get a flu vaccine this season. The second reason is because we don't know for sure how many COVID tests we're going to do. But the fewer that the more that we vaccinate against the flu, then it could be that the less we may have to do some flu tests. And so that's another reason. It may be a way that we could spare COVID tests. The third reason is that honestly, we don't want people getting the flu. The worst year in Texas in the last 5 years for flu deaths, that particular year, in the last 5 years, 11,000 people died due to the flu. That's in Texas. And so that's not a number that we can just dismiss. And so multiple reasons to get the flu vaccine this year.
Okay. All right. Is there a ban on elective procedures, or has it been lifted?
Dr. Morrison and Dr. Haskett, can you each take that for your systems, please?
Yeah, I'm happy to take that, Mayor. There is not currently a ban. We are subject to certain restrictions based on the governor's current orders. The hospitals are required to maintain certain capacity and resources to be available for potential COVID surges. And if we don't have that capacity, then we do have to limit procedures. I think we talked about it last week. We're not currently banning anything. We are having to manage our resources carefully. That still, under our current conditions, means that some people awaiting important procedures and surgeries are having those procedures and surgeries delayed. We're trying not to impact anybody's health long term and still have the flexibility to do those things that are truly urgent and emergent. But we still are in a situation where people are having to delay and forego necessary care because of the current level of COVID in our community.
So I'd like to second what Jim said. No, there's no ban on procedures, but we have certainly had to manage it based upon the volumes of patients that we've had. And I think that's a reality that we're going to continue to deal with. These patients are sick and they require a tremendous amount of focused care to give them the best chance of recovery, which is absolutely what we all want to do. And sometimes that takes and causes us to need to divert some of the resources that we might be able to use on elective surgery cases and take that and use that on the more pressing need. But currently we're open for business, and we are doing universal testing of everybody at Providence. Asymptomatic carriers, we're trying to do our part to catch that before they come into the hospital. So we'd like to think it's a safe environment, but it's certainly a story that's going to continue to be revealed to us all in the community over the next several months.
Okay. What are you hearing about a possible surge when winter comes, or even a possible COVID-20?
Dr. Haskett, would you speak to that? And then maybe Dr. Morrison or Dr. Wilson, if you have anything to add to that.
So a possible surge, it kind of implies that we had a summer that was restful, which is typically what we have with respiratory viruses. And we certainly didn't have a summer quiet time. So I think that we have to acknowledge the obvious, which is schools are coming back into session and people are fatigued. Not to mention the holiday season is coming. We have a lot of potential for very rational people to perhaps find themselves in situations where they could get exposed. And as they get exposed, some will get sick. And once they get sick, then it becomes kind of an exercise. As Mayor Deaver has said, it's kind of a math exercise at that point to some degree. It's inevitable that a certain proportion of people who get sick will get much sicker and require care and even pass away. So I don't know about a surge. My gut tells me that we're going to have some really serious challenges over the course of the fall.
Yeah, and I'll echo what Dr. Haskett shared with us there. I mean, our concern is that flu season is typically the busiest time of the year for us at the hospital anyways. Seasonal illness stretches our capacity in a normal flu season. And in a busy flu season, we can have our capacity very much tested. Now we're in a situation where with COVID, we already have a significant respiratory illness that has on a continuing basis now continued to occupy 15 to 20% of our hospital beds in this county. And now we're going to layer on a flu season on top of that, potentially in the fall. So that's our concern. Resources that are already stretched being further stretched in the fall. I'm not so concerned about a new COVID-20. I'll be, at this point, I may be surprised if we've even gotten through the first so-called wave by the time we get to flu season. We have not achieved any kind of adequate suppression or containment in the state of Texas or really nationwide. So potentially a very difficult situation coming up with the coming of flu season in the fall.
Dr. Wilson, would you like to add anything?
Well, just because we have another question about this very topic later, or there's some overlap, I guess, I'll just go ahead and sort of cover my answer to that question at the same time. There was this other question refers to is the virus mutating, and is that good or bad? What does that mean? That's the question. The virus can mutate either for better or worse. It could be less infectious or less deadly, what we call virulent, or it could be more infectious or virulent. We have identified various strains of SARS-CoV-2, COVID-19. I think that there's one that was publicized within the last month, mutation on what's called a spike protein. There's an article in a journal called Cell that described this, and it's thought to have made COVID a little bit more infectious than some other strains, but not thought to make it more deadly or what we call more virulent, as I say. I did see another article. Again, this is all referring to the COVID-20 question in this question that you're asking, Larry. There's another article that I saw in a journal called Science News from just within the last week or so that says that there's currently 6 main strains of coronavirus, but we do believe that all of them, once we have a vaccine, will respond to that vaccine. And so these are all very relevant, I think, comments and concerns with when we talk about mutations or different strains.
Okay, I'm going to stop our questions that we have here because we've pretty well covered most all of them. And we're going to go to the media. We have 3 representatives who have called in and registered to be in the meeting. We have Drake Lawson from KWTX Channel 10. We have Rihanna Sagert from the Waco Tribune Herald. And we have Shaquille ONeal from Fox 44. And as I call your name, we'll unmute you and we'll let you ask your question. If you'll then remute, then we'll probably do 2 rounds of questions, so each of you get a couple of questions. So let's open the mic now for Drake Lawson with KWTX Channel 10. Drake, are you on the line?
Yes, sir. Larry, can you hear me?
Yes, we do.
All right, perfect. I wanted to ask a question. I don't know who's maybe best to answer this out of the group that's here. I know Dr. Werner would probably be the best person to ask. But we have spoke with quite a few school districts in the area, specifically McLennan County, about what their plan is should a student or staff member get COVID-19. And one of the things that we had heard from multiple districts is that they haven't been given any guidance from the health district as far as what qualifies a campus closing down. What would require a campus to close down? I know in Bell County, they've given guidance of 2% of staff members and students. What is a number, or is there something that you look for as when it is time for a campus to close down? And will the health district close down a campus if that gets to that point?
I'll try to speak to that because I have talked with Dr. Werner and with other members of the health district, as well as Deidre Emerson, who is the assistant city manager in charge of the health district at this point. The CDC has not given guidance on this, and neither has the Texas Department of State Health Services, which should give you some idea of the difficulty of dealing with this on a case, on a broad basis. It really is going to have to be, for now, on a case-by-case basis. I think and I hope that the health district will begin to be able to develop some better guidelines. But with a lack of national guidance, a lack of statewide guidance, everyone is having to try to figure this out for themselves. And so I do think this will evolve over time, as I said earlier, and hopefully we will be able to provide more guidance in the near future.
Okay, thanks, Drake. Let's now move to Rihanna Sagert, who is with the Waco Tribune-Herald. Rihanna, are you on the line?
Yes, can you hear me?
Yes.
My question, clarification from something from earlier. What exactly is Dr. Werner's role in coordinating with the school district?
So
you're drifting in and out.
As we've talked about before on this, Dr. Werner is the McLennan County Health Authority. He is a contract employee of the Waco McLennan County Health District, and he serves as the McLennan County Public Health Authority under state law. And so in that role, he is responsible for making final decisions about certain health matters. And that could include closing a school, although he has said that he would work with the local administrators to figure out whether a school should be closed or what measures should be taken based on the size of the outbreak, the age of the students involved, whether it involved multiple classrooms or just one classroom. There are a number of factors that he would want to consider before taking that action.
Okay. All right, let's move to Shaquille ONeal with Fox 44. Shaquille, are you on the line?
Hey, can you guys hear me?
Yes.
Okay, so Big 12 is moving forward to host football games, and Baylor is having their football game in September. So how concerned are you with out-of-town fans coming in? Do you think this will cause the amount of cases here in Waco to rise?
That's a great question. Would any of our medical team like to take a shot at that? Dr. Wilson?
Not really. No, I'd love to. I'll give it a stab. There's a whole lot of events that people wonder, will this sharpen the curve? The protests, we had the same question. I know the schools reopening is not an event per se, but the schools as an institution, everybody's looking through that at that through a microscope. The question of the football reopening, I think it will just, I probably don't have a great sharp answer for you, but it will just probably depend on how it's done and how socially distanced and wearing masks and things that the players or maybe some of the fans will be. I don't know all the particulars. I believe there's some talk of 25% stadium occupancy and that sort of thing. And so that will definitely be a lot better than having 100% stadium occupancy and maybe good enough to where it won't make any appreciable difference in our local regional COVID numbers.
Yeah, and I will say, having talked to Dr. Livingstone, that they are planning to have the stadium limited to 25% and all the fans will be required to wear masks. So I think, inside the stadium, we may be able to control things and have them socially distanced. What I'm most concerned about personally is the before and after of the games, just like passing in hallways at school. It's those uncontrolled situations where I think you're liable to have a lot greater chance for spread. And if people would just wear their masks and stay socially distanced, I think we have a good chance that we could get through those openings or through the football games. But I have my questions about whether they will actually do that when they get into that social setting.
Okay, let's go back to
much about the football game, but more about the tailgating.
Exactly.
That's right. Okay, let's go back to Drake Lawson from KWTX Channel 10. Drake?
Yes, sir. One last question on just the schools. And I think we've mentioned this before, but maybe, I don't know if there's one way we can get a little bit more clarification. Does the health district have the power to close down a campus or to step in and tell a school district they have to close?
I believe that the health authority, not necessarily the health district, but the public health authority, which is Dr. Werner, does have the authority to do that in a specific outbreak situation. Judge, do you have a different or any different view of that?
No, I thought the way I understand it, that is exactly right. He looks at every school's on an individual basis, on an individual entity basis, and makes that determination. And I do believe that he intends to work closely with the school administration, because there could be some kind of strategy to keep from closing it down, yet to handle the spread. So that's the way I understand it as well.
Okay, another question from Rihanna. Do you have another question for us from the Waco Trib?
You mentioned how these things go in cycles, and that after an increase in cases, there's the increase in hospitalizations, and then the increase in fatalities.
You're coming and going. I didn't hear that. Did you hear that, Mayor? Anybody? Can you?
It's breaking up pretty badly.
Rihanna, can you restate your question?
What if I typed it in? Would that be all right?
Text it to me.
We can hear you now.
Yeah, go ahead and try again. Yeah.
Are we seeing as many fatalities per week as we will, or do we think that number will increase next week and the week after that?
So what I understood, Rhiannon, was you were saying that, we talked about how the first indicator is new positive cases, and then hospitalizations, and then deaths trail behind that. And do we think that we have reached sort of the top of the curve on deaths yet, on fatalities, or will they start to decline? Is that basically what you're asking?
Yeah.
Okay. Dr. Wilson, can you take that question, please?
Yes, I would have to, what I do know is that there have been 5 deaths within the last 24 hours. And so it certainly seems, just based on that number, that we're not on the downslope of a fatality curve just yet. I of course, agree that the fatality curve lags behind the other 2 curves. And so I anticipate that it's soon to come that the fatality rate will be decreasing, the number of fatalities per day. But I don't know that we're quite there yet.
Okay, last question from Shaquille ONeal from Fox 44.
Okay, now going back to football again. So a lot of these, so Baylor has 25% capacity, and a lot of these schools around here, they're thinking about canceling their season. How do you think this will hurt Waco's economy?
Well, I'll start on that, and Judge may have some other thoughts as well. It certainly will affect Waco's economy, though there are 5 or 6 games, home games a year, and those are all big events for Waco. And they are certainly big events for certain businesses within our city. But as a broad category, Waco has a much broader economy than Baylor football. So we will be fine as a city. There will certainly be some businesses that will be very badly hurt by this, and I don't want to underplay that. I mean, those that cater specifically to those tailgaters and people that come into town for those games are going to be suffering during this. But I think the entity that is going to suffer most is the university. Each of these universities is really dependent on football dollars to fund a big part of their program. And so if they're not able to have home football games and football games on TV, that is going to really impact their bottom line, and that will make a dramatic difference in the services that they can provide to their students and how they move forward. So I understand the strong desire to try to have these football games, and it's not just for monetary reasons, but that certainly plays a role. Judge, do you have anything to add?
Well, you're exactly right, and you did mention there are certain businesses will be hurt more than others, and of course the restaurants and hotels are the primary ones. But it's not just, of course, their bottom line, which is the biggest impact, but also there's a lot of sales tax revenue and bed tax, tax that comes back into the community. And a good example is a venue project out at the North Texas Fairgrounds. There is the debt on that is relying on 2% occupancy tax in hotels to service that debt. And there is a significant drop in that revenue, although there was money built in early on to be able to cover another couple of years of debt service on that. But that's just one example of the consequences of this happening. I work with several entities to put on events and to help support those. And most of them have either eliminated the event for this year or cut it back, very much that it won't hardly resemble what it was intended to. So, yeah, it's a big problem.
Okay. All right. Thank you all so much. Thank the people from the media for asking some good questions. And now it's time to get to our wrap-up session, and we will kind of go in as kind of the same order we can. We'll hear from each one of you just from whatever you want to say at the final part. We'll start off with Dr. Morrison, who's the Chief Medical Officer for Baylor Scott & White.
Thank you again, Larry, and just like to say thank you for the opportunity to participate, and on behalf of the thousands of healthcare workers and first responders across our community in McLennan County, I would just ask you to please keep practicing social distancing, wear your face covering when in public, and wash your hands frequently, and let's beat this thing.
Dr. Richard Haskett, Chief Medical Officer for Ascension Providence. Dr. Haskett?
I'd like to echo what Jim said. I'm very grateful for the continued dialogue, and just a plea coming from those of us that are trying to represent your healthcare workers. But I would like to acknowledge one other thing just about me personally, is that I'm a Texan and I don't like people telling me what to do. I think we're all like that. And I just don't like the idea of some little bunch of proteins coming in and destroying college football and the fair and Halloween and jobs and back to school and all the things that have impacted so many people. And sometimes it feels powerless. And when people feel powerless, they get angry. And when we get angry, we react. But you're not powerless. We're in this together, and really just a simple thing like masks and keeping a little distance and following those things that you really don't want people telling you what to do, but you probably ought to listen this time. We're going to get through this much quicker if we can realize that there's so much in our control, and it really will make an impact and a difference. Thank you very much for allowing me to participate.
Thank you, Dr. Haskett. Dr. Ben Wilson with the Waco Family Health Center. Dr. Wilson?
Yes, again, echo everything that everyone else has said, and on behalf of Waco Family Health Center, definitely a privilege to be a part of these discussions. To sort of tag on to what Dr. Haskett was saying, the power is in our hands to change. We have made the decision as a society, as a country, a state, a county, that we're going to move forward with certain risks. We're going to reopen schools. We're going to reopen some of our businesses at various capacities. We've made this decision that we are going to take certain risks, but we can still, regardless of what you think about those risks we're taking, much of the future is still in our hands. We still have the power to affect change. And it's not just the coronavirus curve that affects us, impacts us. It is us that impacts the curve. And it is so critical that we understand that all of the typical things that people talk about in this regard are just so important, with the masking, the physical distancing, the hand hygiene. And then relevant to today's discussion, we should tack on getting your flu vaccine to not make this fall any worse than it has to be. Thank you.
Thank you. McLennan County Judge Scott Felton. Judge Felton?
Well, again, thanks to all those who've contributed to today's press conference. I think one thing that both Dr. Haskett and Dr. Wilson brought up is talking about measuring your risk. And as Dr. Haskett said, you can get mad about this if you want to, but you better keep your eye on the ball, especially if you're in the age group that I'm in, where the consequences of contracting something like this might be a lot more severe than somebody like real young and physical fit like Kyle is. And so anyhow, it's keep your head in the game, pay attention to what you're doing, and just remember, don't put yourself in a position or go to places that put you in a bad position to cause you to take on more risk. And so I always look at that. I don't live in a shell. I do get out some, but I try to be careful about, what I do and how much of that I do as well. Thank you.
Thank you. Waco Mayor Kyle Deaver. Mayor Deaver?
Well, thank you, Larry. And I want to thank Dr. Ben Wilson from Family Health Center for joining us today. And Dr. Haskett, thank you for joining us as well from Stitch and Providence. And Dr. Morrison, again, from Baylor Scott & White. We really appreciate all of you being here. And Judge, always appreciate your wisdom. And it's always a more entertaining press conference when you're here. So we appreciate that. I want to remind people that Baylor students are going to begin arriving in Waco this weekend. The freshmen are arriving this coming Sunday through Tuesday, and many more Baylor students will be returning over the next few days. Baylor has thoughtfully required all of its students and faculty to test before they return and have a negative result before they come to Waco. And of course, there are a number of those obviously most of the faculty and staff, as well as a number of the students actually live in McLennan County. And so they are testing as well. And those numbers will start to affect our testing numbers here in the next, over the next week or two. We have several thousand of those that are here in McLennan County. But I really appreciate Baylor taking that step to try to limit the number of positive students who would be coming to Waco from coming until they can get a negative test. That's a very good thing. I want to comment a little bit on face masks. Many of you have probably heard about this, a study from Duke University that came out earlier this week. And the headline in many papers and in many areas was that some masks are worse than not wearing a mask at all. That was certainly a part of the study. But the main part of the study was masks are generally much more effective than not wearing masks. The study ranked, it was a pretty simple study, but it ranked 12 or 14 different face coverings for effectiveness. And the most effective was the N95 mask. That's not surprising. That's what our frontline medical workers are wearing. And those should be reserved for our frontline workers. Surgical masks were next. And then many different kinds of cloth face coverings were nearly as effective as surgical masks. The two that were least effective were bandanas, and the least effective of all were net gaiters, fishing gaiters, which I held up in here in a press conference 4 or 5 weeks ago and said, I wear this when I'm hiking on the trail at Cameron Park and I pass people. And the point that they made about those is that it may be that they break up. They're not thick enough to stop the droplets from being expelled, and they may actually break up the larger droplets into smaller droplets that hang in the air longer. So those are no longer recommended, and this is the kind of thing that we've talked about where new information is going to come about, and we're going to have to pivot a little bit. And so I'm no longer going to wear a net gaiter when I'm out working out. I'll take a regular mask and just put it on when I'm going to pass someone. It's a little less convenient, but if that's what works, that's what we need to be doing. So that's if you haven't seen the story about the study, take the time to actually read what was said there, because the headline was somewhat misleading. I want to ask that you continue to keep our first responders and our frontline healthcare workers, as well as the victims of COVID-19 and their families, in your prayers. This continues to be a very difficult time for many. We are making some improvements in our community in the fight against COVID, and that's a very good thing. But we've got to keep fighting this and get it back down to an area where we can continue to function well as a community, and we don't overwhelm our healthcare facilities. So please continue to take care of yourself and take care of each other. As Dr. Haskett, Dr. Wilson, and the judge all pointed out, it is a matter that we have the power to do the right thing. We have the power to affect how our community does through this. And many, many, many of you have been doing that. And I'm so grateful for that. We've got to continue to take care of ourselves and take care of one another, and we will get through this together. Thank you.
Well, I want to thank all 5 of you all again for excellent information and sharing what you have, not only technically, medically, and everything but the things that our community needs to hear. And I want to remind you all, as what the mayor mentioned earlier, there are 3 days of free testing coming up tomorrow, Friday, and Saturday out at McLennan Community College at the Highlander Gym from 8 a.m. to 4 p.m. And it's a cheek swab, so it's not the invasive up the nose routine, and it's not very comfortable, but it's free. So if you suspect or have any reason at all to think that you might have the virus, get it tested now so we can eliminate you, and you would know whether or not you can be isolated from that. It's ever changing, as everybody has said, and we want you to always keep in tune with what we're doing here to get you informed, and we hope this will help you do the better job that we all need to do together. Thank you for joining us, and have a good afternoon.